Okay. Man, sometimes this Zoom's not easy to work with. Okay, there. This is what I wanted to talk about. Okay, so if you remember from chapter 5, when we were talking about addiction, here's your willpower. Willpower is coming from your orbital prefrontal cortex. It's right behind your eyes, those cells. And those cells send glutamate releasing axons over to these GABA axons over here in the nucleus accumbens, which then causes this inhibition of dopamine release. So that's how, I think at the time we were talking about, you're at a party, you see someone on the other side of the room you find attractive, and you get this rush, this excitement, but the other part of your brain, the thinking part of your brain is like, I don't know, that person looks like they'd be a lot of trouble. I'm probably just going to get in trouble if I do whatever. But here, it's like alcohol comes in, and one of the first things it hits is your prefrontal cortex, and you weaken this inhibition, right? This willpower is inhibition. So you weaken the inhibition, you go ahead and do it, you wake up the next day, and it's like, what the hell did I do last night? I'm never drinking again. So, and that's also why if you're sober and the person you're hitting on isn't sober, it's not right to have sex with them, because they've lost their ability to say no anymore. So it's still kind of sexual harassment-ish if you do. Well, I shouldn't say ish. It's definitely kind of rapey to have sex with someone who's drunk, because they can't say no. They've lost their ability because of their prefrontal cortex. Okay, where are we going? Oh, hang on, let me look at my notes again. Okay, so loss of inhibition, your willpower circuit, decreases environmental and situational awareness. This is when you'll do something that normally you wouldn't do. Your salience network is trying to line up your social situation with your current behavior, and that starts to weaken. So you're taking your shirt off at a party, and it's like, buddy, put that shirt back on. Reduces anxiety about the consequences of violent behavior. Never a good thing. We've got that willpower in there for a reason. Like someone says something to you, you want to smack them in the mouth. You don't, though, because that's only going to make things worse. But you're a little bit drunk, you go ahead. Can precipitate aggressive behavior. As we said earlier, it can bring emotions out and make you more aggressive than you would normally be. And that's, anyway, I'll skip that. So anyway, 40% of all violent crimes are committed while drunk. 50% of all crimes and accidents committed on highway happen while you're drunk. So it makes a lot of bad stuff more easier to happen because your willpower is not there. And loss of coordination, stumbling, slurring speech, physical impairment, that's all cerebellum, right? I talked about that before. Okay, in terms of driving, typically in most states, 0.08% is legally drunk. And we saw the chart earlier on what that actually means. Between 0.05 and 0.1, you have a 7-time greater incidence of having an accident. Okay, because your reaction time is slower, and you're not thinking ahead as much. When you drive, you're always thinking about dangers ahead, and you stop doing that. At 0.1 to 0.14, you have a 10 to 20 times greater incidence of accident, and at 0.15 and higher, a 50-time greater incidence of accidents. So, because here, now your cerebellum's getting inhibited, and you're kind of weaving all over the place, and that weaving of the car is just like the weaving of your body. The car gets out of alignment a little bit. Like normally it's getting out a little bit. You're correcting as you're going along. You're making sure you're going straight. Here you get pretty far out before you bring yourself back in. Oh, too far this way. Oop, up, up, up. Too far that way. Oop, up, 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 up. So the drunker you get, the more you weave, both when you're walking and you're driving. And that is not a good thing. Okay, peripheral effects. So whenever I say peripheral, I mean not in the brain, but in the rest of your body. There are actually good peripheral effects of alcohol in moderate doses. So if you're drinking a little bit of alcohol, 1 drink a day to 2 drinks a day for a man, you're decreasing your risk of stroke and heart attack by about 20%. I mean, that's pretty good. And women, less so. Daily alcohol consumption, again, because women will have a higher BAC for the same amount of alcohol. Excuse me. So it actually is healthy to have 1 or 2 drinks a day. I read a paper once. I always look for these papers, obviously. I read a paper once that said drinking alcohol is better for you than running. Believe it or not, it statistically it helps your body more. And why is that? Well, I'm glad you asked. That's because of its effects on HDL. HDL is high density lipoprotein. So your liver controls how much cholesterol is in your body, basically. A lot of people say if you have high cholesterol, you cut out all these foods that have cholesterol in them. Doesn't really work because your cholesterol has got a set point for how much, your liver's got a set point for how much cholesterol you should have. So you stop eating it, your liver starts making more. And that's all there is to it. And that's because cholesterol is so important to your body. I mean, that membrane fluidity thing I was talking about, cholesterol is really important for that. So if your cholesterol level drops, you start having a lot of health problems. Also, cholesterol is the basis of all your steroid hormones, testosterone, progesterone, corticosteroids, all of those things are cholesterol based. So you need cholesterol in your body. So the liver's maintaining that at a certain level. And the way the liver maintains your cholesterol is by LDL and HDL. LDL is made in the liver. It's packaged up with a whole lot of cholesterol in it, and the liver sends it out. And that goes out to the body. And any cell that needs cholesterol will grab an LDL and bring it in. Receptor-mediated endocytosis. It'll grab that particle of LDL, bring it in, use the cholesterol. And then the liver will also send HDL out. HDL is a scavenger. So low density LDL because it's got a lot of fat, high density because it's more protein than fat. So the HDL is the fat scavenger. It goes out, finds excess cholesterol, brings it back to the liver. So you don't have too much cholesterol out there causing trouble. So if you've got really high LDL, really low LDL, really high LDL, really low HDL, you've got too much cholesterol out in your system. And what happens is it starts to get into the endothelial cells in the inside of your vessels, and it builds. It turns the cells into foam cells, and then they die and they form connective tissue, and then that gets calcium, and all this stuff happens, and you end up with atherosclerosis. So this is a plaque that builds up on the inside of your arteries, and that narrows the blood flow. So this is especially bad in arteries that go to your brain and arteries that go to your heart. You can imagine if it was an artery that went to your arm, whenever your arm gets tired, well, you stop moving it. So it would be, if you didn't get enough oxygen to a skeletal muscle, it would get sore and it would be uncomfortable and you stop using it. But your brain has to work all the time and your heart does too. So if you've got an artery going to your brain or your heart, now you've got less blood going there, less oxygen going there. And then you can get a clot that totally closes off that vessel. And that's either a stroke or a heart attack, stroke, brain, heart attack, heart. So that's how heart attacks happen. And you've probably heard of people, well, maybe not at your age, but I've heard of a lot of people who are, suddenly they get a little chest pain. So they go into the emergency room and they check their heart and their coronary arteries are 90% blocked. There's only 10% of that lumen left to get blood in. So that's atherosclerosis, and that can lead to heart attack, and stroke if it's in the brain. So what alcohol does is increase HDL. So it makes your liver ends up making more HDL if you're taking a low level of alcohol, goes out, scavenges up a lot of that cholesterol, and you have fewer heart and brain problems. So here we are, a little bit of alcohol makes you better. Now me, I just want to break even. So I'm going to drink 4.5, 5 a day. Okay. I'm just kidding. No, you end up with a lot of other problems if you're drinking that much a day. So, but 1 to 2 drinks a day one for a woman, two for a man, and you're actually healthier than if you don't drink at all. Bum, 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 bum. Fetal alcohol syndrome. Okay, let me check my notes again to make sure I didn't skip something. Oh, another good thing about alcohol is vasodilation. So which means it relaxes the arteries that lead to your organs. And that's good, especially in the ones that lead to your brain and the elderly. So elderly sometimes get into dementia because their arteries to the brain start to get clogged, like we just said. And alcohol relaxes them a bit, so you get more oxygen to your brain. So that's another good thing about alcohol. Bad thing about alcohol, it acts as a diuretic. In the brain, alcohol inhibits the release of antidiuretic hormone. I warned you about this on Monday. Remember, we're talking about alcohol dehydrogenase, ADH. Here's the other ADH that you need to know. This ADH is antidiuretic hormone. So a diuretic is a drug that makes your body lose water. So ADH goes to the collecting ducts in your liver and blocks them from letting water out. So you're retaining more water. So when alcohol blocks the release of ADH, you end up losing more water. And that's pretty obvious, right? If you drink two beers, 24 ounces, you'll probably pee out 36 ounces, So you're getting rid of more water than you're taking in, and you end up dehydrated. And that dehydration is going to be part of your withdrawal symptoms that we'll talk about later. You know what they say, you don't buy beer, you just rent it, right? All right, teratogenic effects. So this is probably the worst thing about alcohol. Pregnant women. Pregnant women, I'm not talking about a woman having one drink a week or one drink a day even, but a pregnant women who drink every day and get drunk a couple times a week, they run a significant risk of having a child with fetal alcohol syndrome. Let's see, 30 to 50% of births to alcoholic mothers. So you're talking about a woman who's good and drunk every day. 30 to 50% of their children will have that. And that's 6 drinks per day plus binge drinking. Symptoms include CNS dysfunction, retardation, short attention span, decreased learning and memory, hyperactivity. So basically, they're kind of mentally slow and they're antisocial. They tend to be kind of aggressive and violent. Their growth rate is a little bit slower. And facial abnormalities are the easiest way to see this. Let's see. Here's the classic facial looks. So here, epicanthal folds, which are the eyes look a little bit Asian kind of. Low bridge of the nose, and the philtrum here, the kind of wavy part of your on the top of your lip, that's very flat. So if you look at these children here, very flat across here, flat. Epicanthal folds are this extra skin around the eyes here, and there you see it most obviously here, and the ears tend to stick out. I think that's part of it too, isn't it? Maybe I made that one up. Yeah, I made that one up, so don't memorize that. Okay, so you can see it show up in the face. And then also, okay, so here's a lot of the problems: sleep problems, attachment issues, low IQ. With adults, when you've got all those mental problems, you end up with a whole lot of social problems, unable to hold on a job, inability to tell. This is the one that always gets me. I read this somewhere, so I put it in here just because it's so weird. Inability to tell time on an analog watch. That's pretty specific, isn't it? I don't know. Manipulative, sexually inappropriate. So you've got someone who's mentally at a low level and they have a lot of bad social issues going on. See? Bad social issues. So this guy, you can kind of tell he's a fetal alcohol syndrome person. Epicanthal folds, flat philtrum, and wearing the orange jumpsuit, as they say. Okay, hang on a second. Let's see what else we got before we get into this. And also, that's FAS, fetal alcohol syndrome. And there's also something called ARND, alcohol-related neurodevelopment disorder. So it's basically the same thing, except much more mild. Okay, so if you're a woman and you're pregnant, do not drink. Not good for you. Not good for your baby. And like I say, you don't have to go overboard. I mean, you can have a drink or two. It wouldn't be a bad thing, especially in your third trimester. First trimester is the most dangerous part because that's where all the early fetal development stuff starts. And so you don't want to mess with the fetus at that point. Once you get into the third semester, pretty much everything's laid out. You're just getting bigger and bigger. A drink a day is not going to kill you. Don't tell my wife I said that. She would disagree with me, but I've got the degree in pharmacology and she does not. Okay, tolerance and dependence. There's 4 different types of tolerance: acute, metabolic, pharmacologic, and learned. So acute means while you're drinking, the alcohol starts to have less of an effect. Even though you're not getting a lower BAC, you're kind of sobering up. So it's a really short-term effect. And that's phosphorylation of GABA and glutamate receptors. So chapter 3, we talked about downregulation of receptors. The first step of the downregulation of the receptor is phosphorylating it. And when you phosphorylate the receptor, it stops working. Eventually it'll get internalized, but at this point we're talking about just phosphorylating it and making it less functional. So while you're drinking alcohol, you end up down-regulating the activity of the receptor. Oops, hang on a sec. So acute tolerance, here a person is drinking, and right here they're feeling pretty drunk. They continue to drink, and they get a higher and higher BAC. Here their BAC is pretty high, but they're starting to feel they're feeling more sober than they did back here. Again, that's just the acute tolerance that's decreasing the effect of the alcohol during an alcohol session. Metabolic tolerance. So this is liver specific. So if you drink chronically or you drink often, your liver will increase its production of alcohol dehydrogenase. And so you'll have a higher first pass effect and a higher decrease in the alcohol in your body over time, accelerated breakdown of alcohol. So, earlier I said, the metabolic breakdown of alcohol is 1 drink per hour. Well, if you're someone who drinks a lot, it might be 1.5 drinks per hour, So, you upregulate those receptors and it goes away a lot faster. If you're really a chronic alcoholic, you have to drink a lot to get drunk. I mean, there was a guy I knew, he was a carpenter. He'd work all day. As soon as he got home, he'd start drinking vodka. He'd drink a handle of vodka every day. Every day he drank a handle of vodka. Well, gorped his liver and he died. So that's a lot. But when you're a chronic alcoholic like that, it takes a lot of alcohol to get you drunk. Okay, pharmacologic. This also plays into that effect. Hang on, let me see what my other. Okay, so here's metabolic tolerance. When you haven't developed tolerance, alcohol comes up and then the alcohol comes back down. And when you have got the tolerance, the alcohol comes down a lot faster, okay, because your liver's been breaking it down. Oh, so here's metabolic tolerance. This is what Christy was talking about. This woman was arrested in Vermont. She was driving a minivan with, 6 kids in it, and she's weaving back and forth, and they pulled her over. And 5 hours after after she crashed, she had a 0.309, 0.31, right? So she had 5 hours to metabolize the alcohol before she was at a level that would kill most people. Right, Christy? So
go pro.
She's a pro. So you can imagine she was probably at 0.5 when she was driving her car. Most people would be dead at 0.5, but alcohol has less of an effect on people who are chronic alcoholics because you're downregulating your regulating the GABA receptors and upregulating the glutamate receptors. So alcohol is blocking glutamate, so they get upregulated, and it is look, it's not that finger, it's the other finger. And it is activating GABA receptors. So GABA receptors are getting downregulated. So if you've got fewer receptors, alcohol has less of an effect, right?
Yeah,
So
totally.
this person's probably at 0.5 driving the car. Not well, but driving the car.
She probably drives better when she's intoxicated, which is sad.
Well, I bet you she drives better drunk than she does if she has no alcohol.
Yeah.
Okay. That's why when, where do I talk about this? Oh, so physical dependence. This is just what I was about to talk about. Well, I'll get into the down regulation in a second. But anyway, um, withdrawal. So withdrawal from alcohol. I don't know about you guys, but I've had a hangover once or twice in my life, so I kind of know what that feels like. So with the hangover, what happens is liver disease. There's a couple things that cause that hangover. One thing is dehydration. I said earlier, you release ADH and you end up losing more fluid than you're taking in, and you get really dehydrated. That causes inflammation, and inflammation is part of that hangover feeling. Also, there's some acute toxicity with the aldehyde that gets made, acetaldehyde gets made, and that causes inflammation. If you've got methanol in your alcohol, that'll cause inflammation. That'll also make you really sick. Also, even short term like that, I talked about phosphorylation of those receptors. You're down regulating the activity of your GABA receptors. No, yes, down regulating GABA and up regulating glutamate. While you're drunk, that's okay, because you're stimulating GABA release, or GABA effect. You get rid of the receptors. The few receptors that are left are still keeping you in a normal state. Now, when you take that alcohol away, you've got fewer GABA receptors. So your normal brain mechanisms are no longer able to keep you in a normal state. Now you're hyperactive. Okay, so when you drink, you get, like, withdrawal is always the opposite of whatever the effect of the drug is. So when you drink, you're calm, you're relaxed, and then when the alcohol goes away, your receptors have changed, and now you're anxious. So you feel really on edge when you're hungover. And also, you don't sleep very well when you're hungover for this reason, because alcohol will put you to sleep, but it won't be a good sleep. It'll be kind of tossing and turning, and the next day you're going to be tired all day because you didn't get a good night's sleep. Also, your anti-reward system is cranked up because you were just getting a really nice buzz. Now you're feeling the opposite effect. So what is a hangover for those of you who have not had one? Irritability because of the hyperstimulation, tiredness because you didn't sleep well, increased heart rate and blood pressure because of the dehydration, fatigue because you didn't sleep well, headache because you're getting vasoconstriction now, nausea and vomiting. Okay, so hangover is basically the opposite of what the alcohol was doing. Okay, chronically though, now we're getting into this lady. Chronically, you have downregulated GABA receptors, you've upregulated glutamate receptors. So when the alcohol is not there, you've got way too much stimulation. You've got a ton of glutamate, you've got no GABA, and so your brain is totally wired. And that's why people who are real alcoholics who wake up in the morning, their hands are shaking. Okay, that's overstimulation, hyperstimulation. And if you are a real serious alcoholic like this woman, you couldn't just quit alcohol, because you would have seizures and die. That's why you have to go to detox, and they'll give you like a Valium that stimulates GABA effect to keep you from dying while you're drying out. And there's so much hyperstimulation. This is what they call the DTs, where they're seeing hallucinations, okay? Things crawling on the ceiling and things like that. Anxiety, high blood pressure, rapid heart rate, delirium tremens, the DTs, hallucinations, tremors, agitation, confusion, delirium. So basically your brain is so stimulated you can't focus on anything, and you can't control your thoughts. You've got stimulation in your occipital lobes, which is putting out images of things that aren't really there. It's pretty nasty. My brother-in-law was an alcoholic back in the day, and he said it was horrible. It was horrible going through the DTs. And he did it on his own, I guess. Didn't go to rehab. Okay, convulsions, seizures, possibly death. So it's the only drug that you can die from going cold turkey. I mean, heroin, methamphetamine, all those other ones, you're going to feel really shitty for a long time, but it's not going to kill you. Alcohol can kill you when you stop drinking it. Okay, and long-term consequences of being a chronic alcoholic, one that everyone is familiar with probably, is liver damage. So what happens is because you're taking in all this alcohol, right? Alcohol is going to be converted into fat in your liver. So it's very easy for it to go into beta addition or whatever to make fatty acid chains. And so short-term use, a lot of use, you end up with a fatty liver. So this is basically liver cells get filled up with storing fat because they've got nothing to do with it. And that some of the cells will start to die and explode. So they can tell by a blood test if you've got liver enzymes in it. That means you're starting to get a fatty liver, and that can be a problem. And then when you're chronic and even longer, you get into hepatic fibrosis. Basically, that means cells are dying. And when cells die, they get replaced with fibrous tissue. So rather than having a functioning liver cell, those cells start to die, you get less liver function, more fat accumulation, and it starts to get cirrhotic. And then end stage here is hepatic cirrhosis, which is basically most or all of your cells are dying or dead and being replaced by scar tissue. And you can't live without liver function. So that's why you end up dying from chronic alcoholism. Like this carpenter friend I told you about, that's what happened to him. He went on a bender once for a couple of weeks and did nothing but drink, ended up in the hospital and died because his liver was dead. Okay, well, that's fun. Let's talk about that some more. Brain damage. Okay. If the liver doesn't get you, the brain will. Okay. So this is there's your liver. Okay, that's a normal, healthy liver. Fatty liver is kind of yellow looking. Here's your cirrhotic liver. Brain damage. So brain damage happens a lot because people who are chronic alcoholics, and they're not really eating. They're just getting drunk all day, every day. So that means they lose a lot of vitamins. When you're losing a lot of water, your water-soluble vitamins will be washed out as well. So you end up with very vitamin deficient. So here's a normal person. In the middle of your brain, you've got these ventricles. I think I talked about these. They're like open spaces with fluid. Cerebrospinal fluid flows through them and then goes out and gets collected by the blood. So it's kind of like a way of your brain to clean itself out. So that's an important way of an important structure in your brain. Here is an alcoholic man. Okay, so here you can see the ventricles are a lot bigger, which means cells are dying back. Okay, you're losing cells. Here's a normal sulcus. Here, sulcus is the crack. Here, the cracks are getting bigger because, again, fewer cells and the whole brain is shrinking. So the brain shrinks down because cells are dying. This is DTI, diffusion tensor imaging. I don't know if you remember that. Looks at the tracks of the neurons. And here you can see big healthy tracks, and here they're getting skinny and worn down. See, if you look at this one here, and then you look at this one here, it's all just breaking down. So basically your brain shrinks and you get stupider. Oops, like that. Oh wait, I've got a chat here. Come here, you. Chat. I can't get my chat window up. Is there a question?
No, it's Wernicke-Korsakoff syndrome.
Right, Wernicke-Korsakoff syndrome. Yeah, the brain shrinks. Liver damage contributes to this because you're not breaking down toxins anymore. And confusion, anxiety, agitation, poor motor function, tremors, and psychosis. Okay. And also, a chronic alcoholic will have gastritis and pancreatitis. So, alcohol is not good for the lining of your stomach, so you're constantly putting alcohol in there and your stomach's getting inflamed. Your pancreas stops working, gets inflamed and stops working, so that makes you really sick too. And it also promotes cancer, especially distilled spirits is because it causes inflammation, and inflammation can lead to cancer. So if you're a heavy drinker, 6 to 15 times greater risk of head and neck cancers right where you're drinking it. Smoke and drink at the same time. Now you've got many different carcinogens hitting your head and neck at the same time. You've got a 44 times greater chance of developing cancer. So, bottom line, people, enjoy your alcohol in a moderate way. Have yourself a drink or two every day. Maybe indulge once a week, but don't become a chronic alcoholic. It's never good. Never ends well. Okay. That's the end of chapter 7. Any questions about chapter 7? Any comments? Discussion points? Anyone want to tell us their alcohol stories? I love alcohol stories. I had a student, when I was teaching this class years ago, came up to me and she said, why is it that some people aren't really affected by alcohol while other people are? And I'm like, what kind of people are not affected by alcohol? She says, well, like me. When I was in high school, me and my friend drank this whole bottle of vodka and we didn't really get drunk. I said, really? Yeah, I mean, they took us to the hospital because I was passing out and throwing up, but I mean, it didn't really affect. Lady, wake up. That was funny. Let me tell you my other favorite story from this class. One time someone said to me, and he was a guy who was missing class a lot. He looked kind of weird. Could tell he had a lot of experience, if you know what I mean. And he said to me, a friend told me that PCP makes your brain skip synapses. What does that mean? I thought about it and I thought, it means you shouldn't get drug information from your friends because that made no sense whatsoever. Okay, well, I feel like I'm talking to an empty room here because I'm just looking at names, not faces. I've got nothing else to tell you.
Do you have a personal drunk story?
Oh, Jesus, do I? I got too many. Oh, here's another good one. Maybe I told you this before, I hope not. I wasn't at this party, but I was told about this party. It was a Halloween party, which is a good time of year to tell you the story. And these friends of mine wanted to have some punch. They're going to put vodka in fruit juice and make punch and put a big chunk of dry ice in the middle. So, it smokes up and a little smoke going real, ooh, scary, scary. So they have this party, they make the punch, everyone's standing around. And like within a half an hour, everybody's laughing and they're having a great time. And in an hour, everyone's gone. Everyone's just drunk and throwing up and the party's over, ruined the whole party. What happened was dry ice is a lot colder than water ice. So the dry ice accumulated water ice freezing to it. And as the dry ice was pulling water out of the solution, the concentration of alcohol was going up. But because it was fruit juice, no one knew they were drinking, they were drinking cups of something that was probably as strong as whiskey, just putting it down. So that's an alcohol story. See if I can think of any more.
All of my alcohol stories are EMS related, and that can get way out of control.
Give us one.
Oh my gosh.
It's an anecdote.
Oh. So one of my favorites, we always ask people how much they had to drink, and it's always 2. Well, it's never just 2. Yeah. Well, I actually got called to a shooting, and so we pulled up, and there's these 3 guys. They're all hammered, and it's like 10 o'clock in the morning, and
10 o'clock in the morning.
Oh yeah. Well, it's Texas, and that's our favorite pastime is to drink. So there's these 2. There's this one guy. He's laying on the ground. He's laying against a fence, and he's just kind of laying there dazed. And there's these 2 other guys, and they were like, "Well, we were trying to wake our friend up. And we were like, oh, what were you trying to do?
They're trying to wake him
We're
up with the noise of the gun or what?
No, they were trying to they were trying to shoot the fence above it, and they had a 22 rifle. And
What could go wrong?
well, they shot him twice in the leg.
Oh, yeah, that could go wrong.
Yeah. Well, there's this big artery in your leg called the femoral artery, and yeah, they were
Like a big hole.
Yeah, they were making big holes in his leg.
Oh,
so yeah. So it's called inappropriate laughter when they say, "Oh, well, we were aiming for the fence," and they shot above his head, and then they shot him in the leg. So, yeah.
Well, did he wake up when he was shot in the leg or no?
Yes, he did.
Oh, okay.
Yeah.
So it worked. So in the end, it worked. Yeah.
Yeah. Well, it's firearms and alcohol. Bad combination.
No mix.
that was one of the good ones.
All right. Well, I'm going to let you all go. Don't forget your quiz this weekend. And next week we will be doing, I think, stimulants, either that or opiates. I forget, but one or the other. Talk to you later.